Hello, on behalf of Mayo Clinic team, I would like to present this video abstract to the manuscript that will be coming out in the Journal of Rheumatology soon. The title of the manuscript is Improved Incidence of Cardiovascular Disease in Patients with Incident Rheumatoid Arthritis in the 2000s, a population-based cohort study. An excess burden of cardiovascular disease in patients with rheumatoid arthritis is well recognized, and many epidemiologic studies have reported up to twofold increased risk of incident cardiovascular events and cardiovascular mortality in patients with rheumatoid arthritis compared to the general population. Early initiation of effective therapeutics for rheumatoid arthritis provides premise for improved outcomes, including cardiovascular outcomes. Indeed, there is a signal from several population-based studies of improving cardiovascular mortality in patients with rheumatoid arthritis diagnosed after 2000. Decreased incidence of cardiovascular events and decreased mortality after cardiovascular events could both be contributors to the decreased cardiovascular mortality in RA in recent years. However, longitudinal studies on trends and occurrence of cardiovascular events and mortality after cardiovascular events in patients with rheumatoid arthritis over time, and studies comparing these trends to the general population are scarce. So to address this gap in knowledge, we aimed to first assess trends in incidence of cardiovascular disease in patients with rheumatoid arthritis onset between 1980 and 2009. Second, compare incidence of cardiovascular disease in patients with rheumatoid arthritis versus individuals without rheumatoid arthritis with incidence index date between 1980 and 2009. Third, assess mortality following incident cardiovascular events in patients with rheumatoid arthritis in 1980 to 2009. And lastly, compare mortality following incident cardiovascular events in patients with rheumatoid arthritis compared to individuals without rheumatoid arthritis with incidence index date between 1980 and 2009. We studied a population of Olmsted County, Minnesota, specifically residents with incident rheumatoid arthritis who were adults and fulfilled 1987 classification criteria for rheumatoid arthritis between 1980 and 2009. Comparison cohort included individuals without rheumatoid arthritis from the same source of population with similar age, sex, and calendar year of index. All subjects were followed until death, migration, or December 31st, 2016. Incident cardiovascular events included myocardial infarction and stroke. Patients with cardiovascular disease before rheumatoid arthritis onset or index date were excluded. Cox models were used to compare incident cardiovascular events by decade, adjusting for age, sex, as well as for cardiovascular risk factors and antithrombotic treatments. So the results of the study. The study included 905 patients with rheumatoid arthritis and 904 patients without rheumatoid arthritis as comparators. Adjusting for age and sex, the risk of any cardiovascular events in patients with rheumatoid arthritis in 2000s was 42% lower than in 1980s. The risk of myocardial infarction specifically was 56% lower in patients with rheumatoid arthritis onset in 2000s as compared to 1980s, while the risk of stroke was similar in patients with rheumatoid arthritis across the decades of study. These results remain consistent after adjustment for age, sex, smoking, obesity, diabetes, hypertension, and dyslipidemia. The strength of association attenuated after adjustment for antithrombotic medication use, but the direction association remained the same. Trends including coronary revascularizations were similar to the trends for myocardial infarction alone. Unlike the over 50% excess risk of any cardiovascular events in patients with rheumatoid arthritis in 1980s and 1990s, patients with incident rheumatoid arthritis in 2000s had no excess risk in any cardiovascular events over individuals without rheumatoid arthritis. Risk of death after cardiovascular event was somewhat lower in patients with rheumatoid arthritis diagnosed after 1980s. So in conclusion to this study, and to provide some take-home points, we found that incidence of major cardiovascular events in rheumatoid arthritis has declined in recent decades. This improvement appears to be largely driven by an over 50% decline in the incidence of myocardial infarction in patients with rheumatoid arthritis onset in 2000s as compared to 1980s. The gap in cardiovascular occurrence between patients with rheumatoid arthritis and the general population is closing. Mortality after cardiovascular events in rheumatoid arthritis may be improving. These findings highlight an important milestone in cardiovascular disease management, likely reflecting improved cardiovascular management in population overall and RA-specific factors such as improved control of systemic inflammation in patients with rheumatoid arthritis with timely initiation of effective antithrombotic therapies. Thank you very much for your attention, and please look up our manuscript for more details on the study.